Hey, Jennifer.
Hi.
So, Jennifer is the research coordinator for CancerBridges. So we're going to ask her just a few questions about some of the projects she's working on. So, Jennifer, why don't you tell us a little bit about the care plan project that CancerBridges is just currently writing up and will be published soon?
Great. In 2009, we're funded to do a project looking at providing survivorship care plans for two different tumor groups. We looked at breast cancer survivors and head and neck cancer survivors, which tend to be very different demographic groups, very different groups, or groups with very different supports in place already. And we looked to see if we could provide information about the types of cancer they had, as well as what they need to be doing to take care of themselves, also what kinds of follow-up care they should receive, and also things to look for in case of recurrence. This implementation of care plans has been part of a national academic and also community-driven initiative looking at providing a more appropriate survivorship care. So we did a trial with 50 people to look to see whether this is something that was useful. Developing the care plans was also a big part of this, trying to figure out what to put in, what to leave out, those types of things. So we were able to get feedback not only from the survivors, but also nurses who created and implemented the care plans, and also the survivors' family physicians who tend to take over care after treatment ends.
Cool. And so I'm not sure if you're allowed to say anything yet, but can you say maybe just one or two general statements about
Sure.
what you guys have found?
Well, overall, people seem to like them. There were some things that we're looking to improve about them based upon the feedback of what the survivors said and what the family physician said and what the nurses said. There was quite a bit of different feedback between the breast cancer survivors and head and neck cancer survivors, whereas the breast cancer survivors tend to be, relatively healthy after treatment ends. Head and neck cancer survivors are still very, very sick and dealing with some very basic issues such as how to eat and how to keep their mouth moist. So being able to have a lot more practical suggestions for the head and neck cancer survivors is going to be one of our priorities.
Yeah, well, that's cool. And I know for probably a lot of cancer survivors, having some sort of document to help follow up that experience, chronicling their treatments and what they should do in the future would be very helpful. So it's really cool. That's something you're looking at. And hopefully that's something the CancerBridges Survivor Network and this website will be able to help you with as well, to gain that knowledge and that understanding of what you should be doing once you finish treatment. So, yeah. Once again, we're talking with Jennifer McCormick, the awesome research coordinator here at CancerBridges, working with the Psychosocial Oncology Department at the Tom Baker Cancer Center. And thanks so much for being here. We're really excited about the research that you're doing. And yeah,
Thanks, Mike.
Yo, you're welcome. I get to work with her. Isn't that awesome? It's really sweet. Yeah, cool.